Namaskar and welcome to Apollo 24/7's Health Hour. This is a show where we bring you experts from Apollo hospitals across India. And on this platform, you will meet the expert and you can ask your questions in the live chat. I'll take up the questions and place them before the expert for your answers. So you must be watching this on any other social media platforms, but if you want your answer, if you want the expert to answer your question, please type your question in the YouTube chat box only. On the show, you also can win gift vouchers, discount vouchers, and also you can participate in a health quiz to get gifts and prizes from Apollo 24/7. Download Apollo 24/7 and participate in today's show so that you can use all the coupons and vouchers that I'm going to give you towards the end of the show. चलिए आज का टॉपिक हम बात करते हैं. Today we're going to talk about winter illnesses. So we are presenting you winter illness guide. How do you prevent flu, cold and heart diseases which become really crucial in this season? Today's consultant and the specialist is Dr. Kamal Ahmad ji, who's a senior consultant internal medicine from Indraprastha Apollo Hospitals, New Delhi, with more than 20 plus years of experience. He is a member of Delhi Medical Council and he's awarded the National Merit Scholarship with Government of India in 1985, and he can be consulted for diabetes, hypertension, hypothyroidism, and infectious diseases, obesity, and HIV as well. And Dr. Kamal Ahmad ji has done incredible job in fighting COVID as a COVID warrior. He had done an immense work in the times of COVID. Here we have Dr. Kamal Ahmad ji on the show. Namaskar, sir. Welcome to the show.
Namaskar, good morning, everyone, and all the listeners of 24/7, and Miss Lakshmi ji for inviting me on this
Thank you.
platform. Thanks a lot.
Thank you, sir. And I remember that the kind of pressure that you were in and we were in, and in the times of COVID, and
Right.
how you came up
That's,
to give us some hope and the kind of work that you have done. I appreciate all that you efforts that you've put in, sir.
that was a tough days, definitely, and we are lucky we have just overpowered everything. So every
Thank
system, every hospital, everywhere in Delhi, in overall India, at every level, everyone fought. So it was
True,
a
sir. True, sir.
small
And
contribution from all of us.
yeah, so at that note, I think we should say the fight isn't over yet. While we know a little more about it, but the fight isn't done yet. We just begin the battle with it. Now,
Right.
now the season changed. Now that this every season that we get a kind of illness, especially winter brings plethora of illnesses with it. Let's talk about, what are the common illnesses that one can find themselves in the seasonal change.
Okay. See, mostly the start of the winter in the northern part is mostly, in fact, in the northern hemisphere when we start with October, November, and December. These are the seasons when you have the usual common cold and influenza infections. That's
Ah,
pretty common. Obviously, every one of us had some kind of those common cold or influenza at times during our year stay. So that's one of the most common infections we normally encounter, and as a
yes.
person living in the area. And usually it begins with the change of season, the start of the winter season. The numbers are on a higher side. So mainly the common cold, influenza, and a few other non-communicable diseases, like you pointed out, like the heart diseases. They though happen in the whole of the year, but the numbers are little on a higher side in the peak of the winters.
Yes, doctor. So I see that a lot of people have joined us today. आपके questions जो भी आपको पूछने हैं एक ही साथ पूछ लीजिएगा. If you want the answer in Hindi, we will take up the question in Hindi as well. And we request you to give all possible details in one question. Do not split your question for my convenience so that I can put it before our expert who is going to answer your question. And only on YouTube chat, please. यस डॉक्टर कमल जी, एक और क्वेश्चन है मेरा कि ये कोल्ड इतने जल्दी स्प्रेड हो जाते हैं. हाउ डज वन प्रिवेंट द कोल्ड फ्रॉम स्प्रेडिंग? इज इट ओनली जस्ट द हैंड हाइजीन एंड अदर हाइजीन दैट वी हैव लर्नड ड्यू टू इन द कोविड टाइम्स, और एनीथिंग एल्स स्पेसिफिकली?
Well, the cold actually, what we see, the cold part is like one is that common cold, which is usually most of the time is very benign illness. You may not be a, I mean, in like it's so benign that by the time you realize you are a little bit sick and all that, you recover from it. So maybe at home treatment with the acetaminophen, that's crocin and similar drugs can help for 3 4 days you recover. But there's a set of people who had influenza, right? So they get little serious kind of infections where you have influenza A, which is little predominantly like H1N1 or something you might have heard in the society. That is little gives you most of the time little serious infection. Yes, both the viruses which causes common cold and influenza, they spread by more or less the similar route. Like when you sneeze, nearby people around you can inhale the virus directly. Or the second thing, the virus can be shed and put on some fomites and all that, table, chair, you're using door handles and all that. From there, you can touch and contact whenever you're touching your mouth and all that. So those COVID days are still valid here, like those transmissions like that, avoiding crowded places, hand wash, hand hygiene, cleaning of the surfaces still are the gold standard. And whenever you're sneezing, protect your cough and all that
Right.
from spreading. And when you're sick,
Right.
try to contain yourself. Don't interact with much of the people because during those 3 to 7 days of active disease, you are likely to infect others.
Right, right. So again, the risk group and the vulnerable group, children, pregnant women, seniors with or seniors or people living with other pre-existing conditions, are they still vulnerable? How do we protect them?
Yeah, they are the vulnerable groups, meaning thereby they can land up in serious issues. Somehow the children, the pregnant women, and the elderly more than 65, and a group who are diabetic, who are obese, hypertensive, post transplant, and other immunocompromised states where this infection can give you a serious pneumonias and other life-threatening state of the infection. So those patients needs to be little more careful, and preventing the disease would the basics would of prevention would be the same like a hand hygiene, avoiding infected person and all that. And a word of mention on the flu shots would be appropriate at this stage because this is very important in preventing the infection, especially preventing the serious form of infection where you have life threatening. I mean, the data says the vaccine we are using, which is usually every year, twice a year, it's the newer strains are added on to the list, and the efficacy to keep the efficacy growing with the changing trend in the virus. So it prevents almost 50 to 80% of the serious infection. So that gives you very good coverage. So especially in Western countries, almost everyone above 6 months of age are supposed to be immunized with influenza virus every year. But we do here also that practice, but mostly we target the high risk individual because in our country we need to modify things at times because of the other
So,
issues. So,
in
but
our country, who do you advise? Which age group do you advise, and
well,
which group do you?
anybody who is anybody who is 50 years and more, those who are diabetic, those who have coronary artery disease, those who have asthma, those who are immunocompromised, those who are especially post transplant, so pregnant women and all other risk patients should be immunized every year.
So it's a flu shot. You can go consult a physician who can give you a flu shot. People, Dr. Kamalji has given the group that has to be immunized every year. One shot isn't enough. So I think we should
Right.
reiterate that fact that this is something which adds every year. And why is it so,
That's
doctor? Why is it different from the immunization schedule that we have once for lifetime?
Well, the virus keeps changing. There's a lot of technical terms like antigenic drift and all that. These are small RNA viruses. They have a tendency to change every year. So they keep mutating and their character changes. So the vaccine you have taken 2, 3 years back may not be that effective after 2 years.
Correct.
because the virus has
Right.
changed, its characters has changed. So the uh, whatever the companies we are making, they keep updating the viral genome in the system so that the effectivity should be maintained. So almost twice a year they are adding new variants.
Right. Right. So it's almost like, yes, doctor. Please do, in case that you need to take a phone call. Yeah.
Sorry,
So
this
every year, yeah, you got to get your flu shot if you're in the vulnerable group or the risky group, or if you're in the senior group. Doctor, should I start taking the questions? Yes, a lot of people
yeah,
have
yeah.
started asking. Yes. Ayush Ranjanji, yes, you can ask your question. Please go ahead, type your question in the chat box. I shall take up the question very soon. Hussein Alia ji, Ravikant ji, and Snool, I'm going to ask your questions. The first question that I would want to take up is a registered user's question. Here, Pradeep is asking if we can prepare for the season and prevent a cold. Is that possible?
Well, obviously, we can say yes, it is possible, or the other way it can be minimized, taking all the care. The first would be to get a flu shot, will give you a good cover to protect from influenza. The second,
Yeah.
keeping in mind, and I tell you, some flu shots usually we recommend somewhere from, because it's a winter season, illnesses are more prominent in the winter. So we recommend to start getting treatment, getting vaccinated somewhere in October would be a better idea, so that 2 to 4 weeks down the line you're protected from the uh, infection. So one is getting a flu shot starting from October. And obviously, nevertheless, you forget to take in October, you can take it any time like November also. It will always give a cover because it's not only during that period, but it gives a good cover. So preferred month would be October. Then keeping a good health hygiene would always be advisable, as we've discussed that. And obviously, keeping away from those infected persons should isolate themselves for a few days when they're infected. So those things would definitely minimize this common cold or influenza the way it spreads.
Correct. So, Doctor, here there's another thing. The entire talk and conversation or attention that immunity got while we were going through COVID and the pandemic. How good is that, and how much of stress that individual has to take care of building their immunity?
Well, normally an individual who is a normal, a disease-free individual has a good immunity. We presume that they normally, almost everyone has a good immunity to fight. And those who are already exposed, either in the form of a vaccine or a form of infection in the past, has usually a good immunity against that virus or
Right.
bacteria, whatever you say. So immunity is like person's own system to fight the infection, right? So that is very important for to tackle the infection. If you have a low immunity, you cannot do, because we see diseases where the immune system is totally broken down. Whatever you do, you cannot fight the infection. So body's immunity is at most important to tackle that part, right? So what
Okay.
we
So you
do,
don't need to
we use
externally
the
आपको कुछ करना नहीं है.
no, obviously
Like,
there is things to keep you good hygiene, good keep maintaining a good health will always maintain a good immunity also. So there are
I mean to say,
components to
the pills
okay.
that are sold in the market, the teas
Well,
that are sold, the vitamins and supplements that people think that will build immunity.
no, they're not related with the directly. They're not related with the immunity. Your immune system is otherwise healthy if you keep a good lifestyle and other things like a good eating habits with a good vitamin supplementation, good vegetables, and overall things would definitely add on to your immune system. But yes, definitely, there's no immunity pill as such we have. That's more of a marketing thing, but there's no immune
Yes.
building tablets or anything like that.
Yes, doctor. I can continue for 3 or 4 sessions if I can continue on the immunity pill and the marketing tactics.
Right.
So I'll
Right.
rest my case there with immunity and I'll continue with the next question. So let me take this Mr. Hussein Alia's question because he's talking about something around cardiac issues. As per Hussein, who's 62-year-old, having cholesterol, the levels are high, and as indicated in the reports. So, especially in the winter, is this going to pose a problem, and how do I control it?
Well, as we all know, high cholesterol levels are a very high risk. Contribute it contributes to the development of coronary or what we call atherosclerotic disease. The arteries in our system, especially the cardiac part, is asking for. They get accumulated and it's known to cause cardiac diseases. What we have that atherosclerotic coronary artery disease, right? So somehow winters these diseases are on a higher side. Like data shows around 20 to 30% the incidences are more in the winter season, especially December, January, with the peak of the winter. The control of cholesterol plays an utmost important in all these illnesses, right? Apart from other high risk things, the control of cholesterol these days has shown a significant reduction in mortality, significant reduction in the disease, both in the primary prevention, and if somebody already had a disease, it reduces that risk and progression of the disease also. So, control
Right.
of cholesterol is very important in controlling both in a primary way, like primary prevention before the disease happens, and we're talking about cardiac disease and its relation with the cholesterol. And once
Right.
somebody already had it, even then it reduces the progression of the disease.
Okay. So, how risky is it? The season is for heart diseases or cardiac diseases. Is it really established that cold can actually have an effect on cardiac diseases?
Well, different data has suggested due to some hemodynamic changes in the body, especially the arteries with the colder season gets little more constricted, giving rise little higher in blood pressure, relatively higher in blood pressure when compared to non-winter days. So they uh, precipitate
Right.
coronary artery diseases. The heart diseases gets precipitated. Roughly, U.S. data shows around 20 to 30% incidents are on a higher side in winter days.
Right, doctor. So next question that I'm taking is Mr. Ravikant. Ravikant is having sinus and seasonal changes and cold affect me the most. It takes more than 15 days to recover generally and more than 20, sometimes more than 20 days. So any precautions that you can advise?
How old is he? Any age he's
Yeah,
referring?
Ravi, can you please type in what age group and where you live? That also helps. Well, I'll wait for his answer. In the meanwhile, doctor, does
Okay.
somebody who is already with the respiratory illnesses, what kind of
Yeah. See,
precautions do
the
they take?
sinusitis. The one thing is like we need to see the chronic sinusitis. Those individuals. There's a component. A lot of allergies surrounding areas where, like with the increasing pollution and other things you're getting. So recurrent infections are mostly because of a sinus diseases. Maybe you have a DNS, some sort of ENT defect which can be corrected. So I would recommend to see him an ENT doctor to just
Right.
clarify there's no
Right.
like obstruction in the airflow which precipitates that infection.
Yes.
And getting a flu shot yearly would help him definitely. That's why I just ask his age and all that.
He's
Uh,
42
so
year old doctor. He's just
yes,
texted that he's
right. So I would recommend him to see a ENT doctor for any obstruction in the pathway of breathing that sinuses can cause. If there's a significant involvement of the sinuses, because chronic infections lead to that, so that can be surgically cleaned and he would feel better. And giving a flu shot give him more immunity on that part.
right. And due to his work, that he has to travel all around India, not just stationary in one part. So he's exposed to different weather
Yeah.
conditions.
So the different weather conditions again precipitates these viral illnesses. So getting a flu shot would prevent him in a better way. Like whenever he travels with the dusty areas and all that, so wearing a face mask would be going to
Great.
help him.
Face mask, flu shot, and just take care of yourself. That's it. Next question that I would want to take. I'm not sure if the question is pertinent to the season, but S. Smule, I don't have the name. Husband, age भी please type कर दीजिए ना please. All of you kindly note, please do type in your age because Dr. Kamal will require your age to answer your questions. Age, gender, and possibly which hemisphere or which place you're coming from. Her husband has decreased his weight by 12 kgs in 2 months. Is it due to the heart related diseases or not? And what kind of precautions do I take? What are the tests that you advise? I'm waiting for your husband's age, ma'am. And in the
Yeah.
meanwhile, somebody who's
Uh,
losing weight.
Yeah, I just brief you about that. The sudden weight loss over the 2 months, 10 kgs is significant, right? That needs immediate medical attention, one. So, most of the patients we found having a diabetes or similar things, the occurrence of new diabetes can manifest with the loss in weight,
Yes.
cosmetic symptoms like passing low
Yes.
urine,
52-year-old, the person
52.
in 52-year-old, and diabetes, kuch hai kya? Can you please type down that as well? Any pre-existing conditions? Yeah, we will wait for that as well. So somebody who's already pre-existing or sudden onset of diabetes also has to be checked out. That's
Yeah.
what Dr. Kamal. Please
It
continue.
usually presents with the weight loss, osmotic symptoms, and all those things. So, weight loss of 10 kgs in 2 months are really significant. So, I would suggest them screening for all routine diseases. Normally, usually, we don't see weight loss as a part of heart disease. This atherosclerotic disease, we don't see. They manifest more in the form of chest pain, breathing difficulty, and those things. That is not a hallmark of heart disease. That's more of a
Okay.
like loss needs. If this is like 52 years, 10 kgs, two
Okay.
months, we would recommend her to
Yeah.
take him to the hospital and screen for the routine
Yeah.
illnesses like diabetes, and there are other many
So
things which needs to be screened out.
yeah, no existing diabetes or blood pressure. So
Right?
that's
So
something that we need to
that
do.
needs to be screened immediately.
Right.
We
Thank
will
you.
recommend him
So the next,
to see, yeah, to see a
yes,
hospital and
please.
screen because the weight loss of 10 kgs in 2 months is really serious.
Right. So Mr. Abhijit Bose, who's 58-year-old male, he's done PTCA in 2016. I'm not sure what PTCA is. You must be understanding that.
That's,
Can
yeah,
can I get flu
angioplasty.
shots now?
Yeah, you can take flu shots. There's no contraindication or no problem with the flu shots. In fact, he should be getting that flu shot every year because he is a risk group. So he can take flu
Oh,
shots. There's no issue on that because he has a cardiac disease, proven cardiac disease, where angioplasty was done in 2016. So he needs a flu shot and he needs to regularly review his cardiologist for that.
right. So people with pre-existing cardiac diseases, what do they have to keep in mind in the winter?
Well, they need to look for the symptoms of angina or breathing difficulties, like somebody who already 2016 or somewhere 5, 10 years down the line underwent some procedure. So later on, the disease is already there. So the stent can get rethrombosed or the other passages areas can be narrowed. So presentation usually happens with the breathing difficulty, like when you exert, you breathe little, you become uncomfortable, or little bit of
Yeah.
heaviness of the chest, and could be those of the presentation. So a regular cardiac visit to the cardiologist would help. Definitely, he will analyze, and if need be there, he will do an angio or similar non-invasive test also to assess the cardiac status.
Right. So any simple blood test that one has to, keep in mind that season R, I want to keep these in check. Any
Well,
physician
routine,
recommended?
the routine cholesterol levels, like we call it lipid profile, which has cholesterol, triglycerides, LDL, and different components of the lipids. That is important. A good control of blood pressure, a good control of diabetes, and similar things has to be screened every yearly for them.
Yeah, let me remind my viewers that Apollo 24/7 also has diagnostic services, and all these packages are available. You can book your, in case that you want to check your levels, go ahead, book your lab test. So, next question is from Mr. Bitumoni K. Mr. Bitumoni, 34-year-old, including me, my husband, Mr. Name, Miss Bitumoni, I'm sorry, 4-year-old daughter, all of them have caught cold, fever, and cough for last 5 to 6 days. None of us have recovered yet after taking medicines. Well, the recovery period, does it vary from person to person? And I have observed, even I am recovering from one, that the recovery process in the last 3 years or 4 years has increased. The time has increased. Is this something that you've observed in your clinic as well, doctor?
Well, definitely depending upon, as I told you, the viruses you are infected and the pre-existing immunity against that virus plays an important role. Usually, common cold is very short-lived, 3 4 days, and it settles down. Though it gives a bit of sore throat, coryza, sneezing, coughing, but normally, fever is not a major part of it. You can have fever a little bit. That's not a major part of it. But as I told you, influenza symptoms are a little more prominent, and it is characterized by a lot of fever, body ache, letharginess, weakness. Yes, if the condition is little prolonging, so they should check their doctor, and a test for influenza would help in identifying the virus. And also, we should be also vigilant for COVID also. So those tests has
Okay.
to be done to differentiate what virus it is, because we have a very accurate and good RT-PCR backup test these days, which can easily identify which
Right.
virus we're talking about. And accordingly, especially in the influenza and all that, we have antiviral agents that helps and shorten the duration of symptoms and the disease, in fact. So that can be
Doctor,
used
so
if you, yeah, yeah,
yeah,
yeah,
please go ahead. Please go ahead. No,
yeah.
जैसे आपने कोविड टॉपिक लिया है, I thought let me ask you how to differentiate between COVID and influenza. Is there any mechanism, or ha-
Well,
how do you understand?
it's difficult to predict from the symptom wise because both present in a more or a similar manner. So the only accurate differentiation would be doing an RT-PCR screening for COVID and screening for influenza. So that will give you the better answer, and accordingly you can plan your treatment and follow up.
Great. So next question that I would want to take up is Rakshak Ji's question. Rakshak AR. Daughter is 6-year-old. Should I get a flu shot every year for her? And which one do we choose, northern or southern hemisphere? Does it matter?
Well, the only thing it matters in the sense like normally once a year would be okay. The northern hemisphere, the winter starts, they have a different timing. So that is the idea of making, because these illnesses are more common during the winter period. Like the northern hemisphere, we usually recommend a vaccination somewhere around October, so that November, December, January, February till March you are covered. But nevertheless, it's said if you missed on the October, November dose, any time would be a better. I mean, you should be vaccinated rather than not going for it. So that is similar is just before the start of winter you can get vaccinated. In the southern part, it's almost the reverse part. So you can do that way.
Yeah. Okay, doctor. So the next question that we want to take up is Shivram Suranaji. He gets cold and cough every 2 months. Can you please suggest what I can do?
How old is he? Sorry to ask this.
Yeah,
His
I
age.
know a lot of viewers haven't started putting in their age. So, Shivramji, if you can please put in your age group there. Yeah, Shivram Surana. But, there are groups of people who frequently fall ill and sick. So, there are, there is
Yeah.
low of immunity or
For those, I
allergies.
would recommend. Yeah. So one is like depending upon a lot of allergic complaints are there that needs to be carefully taken, and they usually they get benefited with getting a flu shot and all that. So I mean, the
Yeah.
boosting the immunity is the giving a
Shivramji
flu
is from
shot.
Sorry, doctor. Shivramji is 26-year-old, Kolkata se hai. Weight is constant at 50 kilos. He catches cold and cough every 2 months. Had asthma during childhood.
Okay, so like he is again high risk individual. Asthmatics are prone to getting, especially with the change in season, change in place, weather. They are prone to get because their respiratory system is little overreactive to the changes. So they are
Yes, doctor.
usually prone to these common cold, wheezing, and all those infections. And for them, would recommend definitely a flu shot is going to benefit them.
Right. All right, sir. Next question is Mr. Rakesh Dikshit, who's 70-year-old male. What precautions should I take for hypertension problem in winter? I am already regularly taking Telmicine 40H in the morning. BP averages at 140 by 100. And doctor, hypertension in winter, does it also have some kind of problematic risk synonym?
Yeah, that is almost the same as I told you because of the little bit of vasoconstriction. The arteries are little constricted because of the temperature changes and all that. So the winters we see the blood pressure normally escalating a little bit more than the summer part. So he has given a data like 140 by 100 is at a 70 years age. It's little on the higher side, the diastolic part. So our recommendation would be to control his BP in a better way. So he need to visit his physician or cardiologist for a better control, especially if there's a variation between a summer and winter. So maybe the winter part would be little upgradation of the medicines would help him.
All right. So, continuation of the same BP question, Mr. Devashish Bhattacharya is 60-year-old, male, non-diabetic, taking BP medicines, controlled BP. But do I need to get a lung function test done?
Well, if we is he having any symptoms related with the lung, then yes, probably any breathing issue and all that. So a baseline, otherwise also we recommend in hypertensives a baseline lung function has to be done. A baseline lung function, a treadmill test, echocardiography. As you briefed, Apollo is doing a lot of health checkups and all that, where we do get a lot of positive. We pick up a lot of cardiac patients. We pick up a lot of hypertensives, a lot of diabetics, which they're not aware. So you'll be surprised to see like we pick almost 10 to 20% of diabetes on the first go. They say, no, I'm not aware of this. The sugars are so high, HbA1c is so high. So at times, and we get more of a cholesterol, triglyceridemia. Somehow in Indian subjects, we are getting a lot of these things commonly, which we can interact in an early stage of the disease process, and we can prevent the long-term complication of the same thing.
Right, doctor. Continuation of the same age group and same questions. Sean David, male, 66-year-old, cardiac, diabetic, and COPD as well, under treatment. What are the precautions that one needs to take during the winter season?
Well, one, a good control of sugar is important. Almost yearly evaluation of his cardiac status has to be done, and a good control of cholesterol, evaluation and control of cholesterol important. And definitely with the winter is a high risk group, influenza vaccine, the flu shot we call it, has is going to benefit on that one.
Right. So control your diabetes and keep an eye on other parameters as well. That's what Dr. Kamal has been reiterating right from the beginning. Yes. So next question is Mr. Gopal Lonial. Wife is 75-year-old, cardiac, and had a stroke twice in the last 4 years. Has a BP fluctuation in winter. They live in Mumbai. Is it normal in such patients?
uh, Obviously these diseases like a stroke, you told she had it twice she had two events of stroke in the last 4 years. She's a hypertensive, and she had a so these all diseases, like we have a cardiac disease, the brain disease, that the brain attack, heart attack, the pathogenesis, the making is the same, the soil ground is the same. So the risk of atherosclerotic, this coronary and the coronary artery, what we call the heart, and the carotid artery, what we call the brain attack, are the more, they are the same. So yes, definitely the all those parameters of a control of good BP and other things are mandatory to prevent the stroke. And normally would recommend to evaluate further if there's any, like we do stenting for cardiac part. There is also stenting and management for the stroke part also, but that needs, before doing anything, that's need, whether you need a medical therapy, we need some revascularization procedure, that has to be decided by the uh,
Yeah.
doctor, what is magnitude of the problem.
Right. So a lot of people do fear tablets or any prescription based medicines. They think that these are not good for them. And the fear of, what the side effect could be, they do not want to take. Here's a question, Mr. Praveen Kumar, who's 40-year-old and has high blood pressure and fast heart rate. Doctors have prescribed them with Telis M50 tablet. Can I control without the tablets?
Well, my recommendation would be, if the doctors has prescribed and the blood pressure is high, it's always better to get control your blood pressure. See, the problem is controlling blood pressure is an easy task these days with the modern drugs coming in, and most of the drugs are pretty benign and hardly has much side effects. So it's safe to use those drugs. We know their side effects. In case if you land up in some problems, we can modify our treatment depending upon the side effect. But most of them are pretty safe, and control of blood pressure is very, very important, because they are having a lot of risk of cardiac disease, brain stroke, brain hemorrhages, cardiac failures. So these things are really critical. So
Yes.
controlling BP is a much easier task for us, rather than landing and leaving in going to that phase would be a catastrophe for anyone. So in the
Absolutely, doctor.
easiest
And
way,
he's so young. He's just 40 and he
yeah,
has a long way to go.
yeah, long way to go. So that's the reason for him. Obviously, we recommend to have a good dietary control, good lifestyle modification, de-stress yourself, but those things have a limited role. Once the doctor has prescribed some medication to control the blood pressure and the rate, which both adds on controlling your blood pressure and keeping your heart healthy, he should continue without any second
Wonderful.
thought.
यस प्रवीण जी, दूसरा कुछ सोचिएगा मत, आपको कंट्रोल करना ही है. एंड ऑल दैट यू वांट टू टेक विदाउट मेडिसिन, जो भी आप कंट्रोल करना चाहते हैं उसको भी आप जारी रखिएगा, उसको भी चालू रखिएगा और मेडिसिन को भी चालू रखिएगा. या सो नेक्स्ट क्वेश्चन इज फ्रॉम मिस्टर अफरोज सैयद. डॉक्टर साहब, कैन आई ईट केक आफ्टर एंजियोप्लास्टी? इट्स बीन 2 months. So diet restrictions.
Well, um, it's a difficult questions to answer, but if he's non-diabetic,
Hi.
little bit of would be permitted. But yeah, so these things are all non-healthy things. If you see the cream part and all those things,
Yeah.
well, no 100% no or yes for that, but would recommend to refrain from all these things, especially it's too early. But the focus should be on maintaining a good. I mean, he should continue his medication. That is important, utmost important. Apart from that, good lifestyle, and secondly, a good dietary habit is important in
Yes,
managing
doctor.
everything.
Can I also ask one personal kind of personal question, not from audience? Doctor, there are a lot of practices in Indian cultural kitchen, which is also seasonally change होते रहता है. North India में आलिव के लड्डू बोलिए, गोंद के लड्डू बोलो, lot of the warming spices are added to your food. Winter होते ही किचन में lot of things change, and summer होते ही cooling agents आ जाते हैं. Do they really make some kind of difference, and do they help you?
Well, these spices and all that, it's just a just for the taste and all that. I guess they do not have any medical significance as of now, as I know of it. I mean, we have. I mean,
Yeah.
it's mainly prevalent in Indian subcontinent. These spices and all that. So I don't see that benefit as such of these things medically. Much of it, I mean, by and large, I'm saying. And I mean, we've seen more of a gastritis and gastric discomfort rather than having a lot of spices and other things. I mean,
I know, and
definitely we.
especially the kadas and the kashayams that were sold in the time of COVID. Everybody had some kind of gastric irritation.
I totally agree. In fact, we have seen a lot of patients coming up and saying, "I'm throwing up." Yeah, so we just and they believe this is something very good, and we never thought. We thought because of the tablet he is throwing up, we just stepping up the dose of the antiemetics and all that. Then finally, come doctor, I'm peeing something which is very tough to drink and all that, and after that I throw. So we told them stop, and then he says, "Now I'm better." So it has a irritant capacity which can cause the reflux and you can vomit and all that causes a lot of
Yeah.
gastritis. So
Yes, yes.
medically, I don't see any reason of promoting that or
Take care, doctor. The next question that I would want to take is Miss Rachita, 55-year-old female. The knee pain during winter, the cold season, she has knee pain. Any advice for her?
uh, well, I would only advise to check her vitamin D, calcium, alkaline phosphatase, the what we call the bone parameters, and a good knee exercises to keep the knee healthy, to keep the knee positioning in a better way, is going to help in the long term. Winters are known to precipitate joints and all that stiffness. So if it's normal, it won't affect. So there is some issue, so that needs to be optimized for a better knee care. So I would recommend
Right.
her to see an orthopedician and evaluate and see a physiotherapist for a healthy knee positioning and all that.
Great. Now comes the most important and the tricky question, according to me. Mr. Vinay Gupta, 59-year-old male, is asking, why do we need to take medicines in case of flu? As flu is a viral infection, it'll take its own time to subside. And what precautions one can take so that they don't get infected? I think precautions part you did talk
You
already.
already
So can we talk about over the counter
medic
and already known prescriptions and popping up without consultation?
That's right. The only part of the treatment we have two components in the treatment part. That is the specific treatment. Like he said, viral illnesses. Most of the viral illnesses, except the influenza, we do not have a specific treatment, but we do have a treatment for influenza. Like we have oseltamivir and other zanamivir that is have a proven role in moderate influenza A and B. You can say that's used for that, but by and large, like we have a common cold and other which we do not need to treat with antiviral and all that. So but the problem is, like, you have come to a doctor with a particular symptom. So the second part I was talking about, one is the specific part and the second part is a symptomatic part, that is supportive care. So that is also equally important to get relief of your symptoms. Like if you're running temperature, obviously you may not be feeling comfortable. Reducing the temperature with acetaminophen or paracetamol would give you better help. If you have a headache, body ache, that needs to be tackled. So normally we do not recommend antibiotics for any flu or viral infection, but obviously bringing down the temperature, making you a little more comfortable with the medication is a part of the main treatment. Yes, the virus usually by 4, 5, 6, 7 days, depending upon the immunity and the virus antigenicities, it fades out. So during that period, to give you a better care protection, we need to support you. That's the only idea.
And all the viewers, please do pass on the message. Antibiotics are not for everybody and not that you can take on your own. And this is very, very important. And would you want to
That's
please add, stress the fact, doctor?
That's right. As I told you, antibiotics are has to be prescribed for a bacterial infection, or suppose doctors has usually has to decide when to prescribe an antibiotic and what antibiotic and what age group, what background illness, what kidney functions. So accordingly, we decide and all that. So antibiotics will not will ask not to take over the counter antibiotics and all that. That's not recommended. Every antibiotics has its own problem, and in what diseases you're using what antibiotics is important, right? So normally a bacterial infection, if you suspect a bacterial lung infection or chest infection or a viral infection secondly infected with that, so there
Yeah.
we need to use that, but that is only specified areas.
Right, I have been. Saikat, the next question is from Delhi, sir. 47-year-old male. And Delhi's smog and pollution, as we all know, in this season increases. I'm a regular runner and run early in the morning. How can I protect myself?
Well, this is a very difficult question. So, apart from every agency's government, everybody banning cars and all that. So, with the change in season, definitely Delhi becomes a polluted city.
Smoggy.
Definitely, pollution level goes up, especially the winter starts post Diwali. This because of the probably the change in temperature, mostly the airflow decreases and the pollution gets stuck or whatever you can say. The only thing we can recommend, you need to see how bad is the pollution level. Doing a heavy exercise like running and what, that may not be that good in that polluted environment because your lungs are overexposed to those pollutants. So you need to
Right.
see like those things has to be titrated with the uh, pollution level at that time.
Yeah, Dr. Ahmad, next question is also something related to exercise. Mr. Farooq Iqbal, 43-year-old male, is it safe to do cardio exercises if I have hypertension?
Well, definitely it's safe, but what level of hypertension you have, a controlled blood pressure patient can have whatever normal exercises he can have. Obviously, if
Right.
somebody who had a very high BP is not recommended for a, it's not fit to do a exercise, but a controlled blood pressure person, he can do whatever exercises he wish to.
Right. And also, same person is asking, cold and pollution increases in the winter. So, does air purifier help in this situation?
Well, I cannot comment on that much because we do not know, depending upon the air purification and all that, how much your number of hours you are getting inside the house and outside. There's so many component which affects the 24 hours breathing air. So it totally depends upon that only.
Correct. But
Do companies do
yeah,
recommend
each
and
company has their own
claim?
standards again. You know, what kind of
Yeah,
filtration, what rate it
that's
is
right.
purifying, all of that
Exactly.
differs. Yeah.
Lot of factors
And
and we.
though
Yeah.
correct, correct. So, next questions. Two questions I would want to club and ask. Both of them are effects of cold and cough for a very long period. Rajesh Agarwal is 53, suffering from dry cough for even since last days. 45 days after the fever subsided, also I have dry cough. And the other person is 12-year-old, having the cold on and off for last 2.5 months. All the medicines like Allegra, antibiotic, Vicks, everything is being tried on her, but it's not getting cured. So the effects of cold and cough after the fever subsides.
Right. See, we do see these problems happening when the acute phase settles, where the fever and other part settles, then you have a dry, irritant cough. So most of these coughs they linger on for certain period because of the little bit of damaged alveolar tissues or the lung, smaller damages to the lung, which keeps irritating by producing mucus and all that. But what we recommend somebody who already had the disease, fever, everything subsided, and you keep on lingering with the cough and other issues. So we need to see the doctor. We need to analyze with pulmonary function test, the X-rays, and other things to see is there anything which needs other medical attention which is causing the cough. That has to be seen in the medical OPD. So we recommend him to see a doctor and go for a little further test and analyze accordingly.
Right, doctor. So the next question is about what are the emergency medicines that one has to keep in winter season if somebody has heart problems?
Well, obviously, those patients who has a heart issue, they are usually aware of using a sublingual, putting a tablet just beneath the tongue. It gets absorbed from there. We call it sublingual route. That is, we call it isordil. It comes with many names. Basically, it's a sorbitrate. It helps in relieving the angina, basically. So, if you have a chest pain discomfort, you can use that tablet. Especially the cardiac patients, they know because that process has already been started. So, they are aware there's some discomfort. They keep in under the tongue, and they can repeat also depending upon the response. If the pain is still there, they can repeat it. But if the pain is really troubling and it's there, the severity is high, they must visit or call the ambulance. So to reach
Yes.
the yeah, yeah, for further
Yeah, I think it's,
evaluation and
yeah. On this
is
platform, I don't think we'll be able to give the name of the drug, but yes, if you are a
that
known cardiac
generic we're
history,
talking about that. Yeah,
yes. So on the if you're known, then please go ahead, consult your doctor. Make sure that you have your medicine ready all the time with you. Uh,
that's
Doctor,
right.
it's already 11:51, and so quick last two three questions. Again, flu shot के बारे में काफी सारे लोग पूछ रहे हैं. Elaborate more about anti-flu vaccination. Yes, we did talk about it, Farooq Iqbal ji and Sean David ji. But quickly, is it important to have a? Sean David ji is asking, is it necessary to have it every year, or is it okay to skip a year?
No, the recommendation is it has to be taken every year, as I told you, because of the changing pattern of antigenic drift and all that. The virus keep changing. It's a small virus. The strains keep changing. So to keep that efficacy of the vaccine, you need to take it every year. With the start of the
Yeah.
winter, before the start of the winter, you need to take it every year, right?
Right.
So
Right.
that is important. If you skip the year, the efficacy may not be that good. So the purpose may not be solved what you're going for actually.
Great, doctor. So that's with that I come to conclusion from the audience's question. I take leave, but I want top tips from you, Dr. Kamal Ahmad ji, to take care of ourselves in the winter illnesses.
Well, one, we know that the infectious illnesses, that the flu illnesses would recommend to what I mean, just this few simple recommendation I would like to put forward to you. One, get a timely flu shot every year that would keep your antibodies and a fight against serious viral infections in a better way. And the second is keep your personal hygiene and care, like washing your hand at regular intervals, especially in the peak of any flu season. That is important. And when you have to sneeze and cough, cover your nose and mouth with your hand. And suppose you have a some sort of infection or something similar to a flu, so when you use your tissues and all that, properly dispose it in a proper way, and try not to share your belongings like your plates, your clothings and all those things, the personal things, with others. And try to keep your surfaces clean. That is, somebody who's little infected or have a symptoms came touching your things, so you can clean and wipe it with any disinfectant. And a self-care at home, like somebody who's little sick at home can rest, isolate from the general population. That usually going to prevent the infection from spreading to the other areas. And knowing the symptoms of common cold and a flu, that's the differentiation. Is like usually the common cold is a very benign 2 3 days of illness with not much of a fever as a predominant problem. The other is flu, which uh, is a at times can be serious and usually presents with a high grade fever, body ache, myalgias, and prostration. So that those things to be separated. If you feel the flu is little serious, so consult your doctor or your ER or your hospital uh, for a better care, and do not rely mainly on the antibiotics, because flus doesn't respond to antibiotics. So these would be my tips for this. And we also here recommend getting a flu shot would give you an advantage of protection, along with making others protected also, to contribute in you the herd immunity. So these are
Wonderful,
my
doctor.
recommendations for this winter part.
Thank you so much, because this is very important. Though we think that we know all of these, reiterating them and actually thinking about them to keep checks in place, that helps us a lot. Thank you for your valuable and precious time on this Sunday morning, Dr. Kamal Ahmad ji. Namaskar.
Thank you. Namaste. Thanks. Thank you very much.
Yes, thank you. So here I continue with the health quiz. So health quiz is coming up. You have to participate in the health quiz and you have to type your answers in the chat box, YouTube chat box only, and winners will be selected at the sole discretion of Apollo 24/17. And if I've taken your name to be the winner, then you will have to write back to us at marketing at Apollo 24/7 to claim your prizes. तो चलिए आज के क्वेश्चंस आपके स्क्रीन पर है. कैन वी हैव देम ऑन द लार्ज स्क्रीन प्लीज? यस, हियर आर द क्वेश्चंस. Fill in the blanks. That's the first one. F से शुरू होता है, 3-lettered word. F blank is spread by germs from coughs and sneezes that are on the surfaces for more than 24 hours. Is that true? Please fill in the blanks. Yes or no, common cold can spread easily. Yes or no. Question number 3, true or false? Cold weather exposure can increase the risk of cardiac diseases, including heart attacks. True or false? I repeat question number 1 because I didn't read it properly. F से शुरू होता है word, spaces है, 3-lettered word है, there are 2 blanks there, is spread by germs from coughs and sneezes that can live on surfaces for 24 hours. So that's our question number 1. Question number 2, yes or no में answer कीजिए. Common cold can spread very easily. Question number 3, true or false? Cold weather exposure can increase the risk of cardiac diseases, including heart attacks. These are the 3 questions. Now go on, answer your. I see a lot of people have joined, and let's see who the winners are for today. In the meanwhile, let me give you gift coupons and the gift vouchers, discount coupons that you can use on Apollo 24/7. Ask Doc 150 is the code that you can use on Apollo 24/7 to consult top doctors and get up to 150 rupees cash back on online doctor consultation. The next one that we give is 25% off on medicine orders. Use the code FIRST3, FIRST and numeral 3, and you get 2-hour delivery if you order from Apollo 24/7. And also to our esteemed viewers of Health Hour, this is an exclusive gift voucher that we use. Use the code HH247 to get 199 off on online consultation with doctors and up to 20% off on medicine orders as well. HH247 exclusively for you all. And also Apollo 24/7 is on WhatsApp. If you're looking for medicines or if you're looking to book tests, you're just a call away. Text or WhatsApp call, or it's so simple now. You have to note the number down, 9355247247, and you can avail all the healthcare services like on Apollo 24/7 app. And the winners for today are Madhu, Jagjit Kaur and Sanjay Kumar. I repeat, Madhu, Jagjit Kaur and Sanjay Kumar. Write back to us at marketing@apollo247.com to claim your gift vouchers. So thank you all of you for joining us today. Next week, we are going to talk about the Diwali Safety Guide, managing breathing difficulties, diabetes and burn mishaps. Let's talk everything about safety on Diwali. 5th November, 11 a.m. Next Sunday, we shall see you. Till then, please do take care of yourself. And thank you for joining us in this live session and asking your valuable questions, because your question is answer for many more people. Keep joining us and do subscribe Apollo 24/7's YouTube channel, where you get a lot of information, not just the health hour live session, but a lot of information that you get, and you will be benefited by the wonderful, valuable information. Thank you so much, all of you. Namaskar.